Now the question before us is why there is a need for increased funding and research into mental health. If we say in a few words that the persons suffering from mental health issues are increasing day by day because every person is suffering from some sort of stress, anxiety, and many times due to depression. So all these problems are giving are putting an adverse effect on mental health. So when the population which is suffering from mental health issues is on the rise, there is naturally need that we should increase funding and research into mental health. Now we will go into detail. There is need for increased funding and research into mental health due to following reasons. Next point, first point is prevalence of mental health disorders. Millions of people world over are suffering from mental health issues. The mental health issues are depression, anxiety, stress, bipolar disorder, etc. According to World Health Organization, 1 in 4 people in the world will be affected by mental or neurological disorder at some point in their lives. It means that you can see that the a, 1 in every 4 person in the world is likely to suffer from some sort of mental health problem in his life. So you can imagine the extent of mental health issues the world population is facing. This means that mental health issues are extremely common and can affect anyone regardless of age, gender, race, or socio-economic status. There is need for increased funding and research to address this, this global public health issue. Next point is impact on quality of life. Mental health disorders can have a negative impact on physical health, leading to issues such as chronic pain and weakened immune system. Mental health problems can affect relationships with family members, friends, and romantic partners. It can be difficult to maintain healthy relationships when we are struggling with symptoms such as irritability, withdrawal, or mood swings. Mental health issues can also affect a person's ability at work or school, leading to decreased productivity, absenteeism, and difficulty in focusing on any work. Next point is economic burden. Mental health issues have a significant economic burden not only on individuals and families but on the society as a whole as well. More than $200 billion were spent on mental health services in 2020 in USA. According to a report by the World Economic Forum, the global economic cost of mental illness is projected to reach $16 trillion by 2030. This report highlights that mental illness is a growing concern globally. People with mental health issues may have to spend a lot of money towards healthcare costs. They may face decreased income, financial strain, and difficulty in meeting basic needs such as housing and food because all the money which they may be having is being spent towards meeting the mental health expenses. Mental health issues can also make it difficult for individuals to work, resulting in unemployment. Increased funding and research can develop more effective and cost efficient treatments and interventions which will reduce the economic burden of mental illness. Next point is stigma and lack of understanding. There is still a stigma attached to mental health disorders, which can prevent individuals from seeking help or receiving the support they need. Additionally, there is still much we do not understand about mental health disorders, including their causes, risk factors, and effective treatments. If we incur or increase the funding and do more research on mental health, we can improve public awareness and also improve our understanding about mental health disorders, and we can develop more effective treatments, and in this way we can improve the lives of millions of people who are suffering from mental health issues. Next point is support the delivery of mental health services. Increased funding is also required to support the delivery of mental health services to the people who are suffering from mental health issues, particularly low income populations and rural communities, because they are living in a very faraway areas, and there is need to set up mental health facilities in remote areas as well, and there is need that we are able, that the governments or the public as a whole is able to provide some sort of treatment, that is the mental treatment, to those poor people who are suffering from mental health issues. This includes such type of funding will include funding for training and support for mental health professionals, as well as for community based programs. It is the need of the hour that the policy makers, healthcare providers, and the public recognize the importance of mental health and prioritize the funding and research into mental health. By investing in mental health treatment and support, we can reduce the economic burden of mental health and improve the mental health and well-being of individuals and communities. Now we will conclude this course. Mental health issues are extremely common, and these issues affect people from all walks of life, irrespective of gender or age. Good mental health and well being are essential for living a happy and satisfying life. Taking steps to improve mental health and well being is important for both individuals' health and the health of communities as a whole. It is the need of the hour that policymakers, healthcare providers, and the public recognize the importance of mental health and well being, and we all together take necessary steps so that people, especially those suffering from mental health issues, have access to support and treatment they need to lead healthy and fulfilling lives. Thanks for watching. If you like our course, please spare some time to give a star rating to our course.